for tobacco and for alcohol.
Sir, please repeat the question.
क्वेश्चन ये कि
सर हिंदी में बताइए।
सवाल ये कि 100 लोगों ने शराब लिया, 100 लोगों ने तंबाकू लिया, ठीक है ना? 100 people took alcohol, 100 people took tobacco, and they continue to do like this. Yeah. So how many will get addicted to tobacco? Let's say end of 5 years. How many will get addicted to alcohol at the end of 5 years? Approximately.
टोबैको
तंबाकू रहेगा सर, क्योंकि तंबाकू वाले की लत नहीं छूटेगी।
टबैको सर।
आई एम आस्किंग नंबर्स, कितने? 30, 40, 50, 60, 80, 100 से
80
कितने होंगे?
100% तंबाकू वाले तो 100% रहेंगे सर। अल्कोहल वाले कम हो सकते हैं, तंबाकू
अच्छा।
वाले 100%।
ओके ठीक है। रिसर्च ये बोलता है कि टोबैको में 30% of people who started tobacco at any part of life will get addicted. 10% of people who drink alcohol at any part of time get addicted. As per the research, but it can vary from the country to country. Okay. Okay. Now, what percentage of people in India use tobacco? 100 से कितने लोग किसी भी तरह का टोबैको यूज करते हैं? काफी लोगों ने लिखा है 48%। सही है, गलत है?
Wrong.
सही है सर।
28%.
20, अमनदीप जी बोला 28%, सर ने बोला 48%। एनीबॉडी एल्स?
28%.
What is coming very?
यूपी बिहार में तो सर
हिसाब से तो 28% होना चाहिए। और
मैं आई एम टेलिंग अबाउट पान इंडिया। मतलब थोड़े तो देयर विल वेरिएशन अमंग द स्टेट्स, नो डाउट, बट टॉकिंग अबाउट पान इंडिया।
28 and 48 are
40%।
28%.
समझ आ जाना वो कितने हैं वो?
28%.
ओके
22%.
28 या 48? 28। राइट। सो मैं आंसर बाद में बताऊंगा, अभी आई एम कीपिंग इट मिस्ट्री। आई विल टेल अगेन आफ्टर सम टाइम। बट काफी लोगों ने लिखा है 48, 50% लोगों ने 48 एंड सम आर 40,
तंबाकू
38।
सर, तंबाकू को भी अलग अलग फॉर्म में लोग यूज करते हैं ना। कोई गुटखा खा रहा है, कोई खैनी खा रहा है, कोई सिगरेट पी रहा है, तो ऐसे तो ज्यादा ही जाएगा सर।
You are right, sir. I am trying to understand all total, चाहे गुल हो, चाहे तंबाकू हो, गुड़ाकू हो, मिला के मैंने लिखा है सब कुछ। बट आई एम टेलिंग एज सच वेयर एवरीथिंग टुगेदर। बट यू आर राइट कि अलग अलग च्यूइंग है, स्मोकिंग है, स्मोकलेस है ना, अलग अलग। ठीक है, फंटास्टिक। वेलकम द आंसर वंस पोल इज ओवर। पोल चल रहा है अभी, लोग अभी भी टाइप कर रहे हैं। लेट हैव 1000 पीपल टाइप, देन विल कम टू द आंसर्स। ओके, इसमें कौन सा तंबाकू है नहीं? व्हिच इज नॉट ए टोबैको हियर? गुमती, हुक्का, बोंग, चुट्टा, ये 4 नाम है, उसमें तंबाकू कौन सा नहीं है?
Bong. Bong, sir. Bong.
Dumti.
बोंग इज टेलिंग नॉट है।
Dumti is come.
ओके,
सर मेरे स्क्रीन पे ना वो 15 क्वेश्चन दिख नहीं रहे, वो हट गए हैं। मैंने सबमिट नहीं किया है, तो फिर वो कैसे आएगा?
वो सबमिट हो गया तो गया।
सबमिट नहीं हुआ।
क्या हो आंसर
Sir, we
फाइनल?
didn't know the other variety of tobacco users. We just only know tobacco or canning. Nothing else, the variety.
Fantastic,
We didn't even
fantastic.
hear that.
Okay, no, because India is a big country, no, so each part of country different names are there. That's why I try to put some of the names here. धुमती कहाँ बोला जाता है? Anybody can tell धुमती? धुमती, which part of
sir.
country people talk of धुमती? कोई नहीं?
नो आइडिया सर।
No idea. No, so I'm asking everybody join from all part of the country, so anybody might be knowing it. ये जानना चाहते हैं इसलिए। नहीं,
Actually, usually we only know that canny, tobacco, gutka, but we don't know other name of this kind of variety.
ये हुक्का के बारे में जानते हैं सर हम तो, ये दुमती चुट्टा बम
Try
कुछ
to
नहीं।
no problem, no problem.
Himachal.
चलिए बिहार वगैरह में बोला जाता होगा।
दुमती राजस्थान.
यार मैं सूरती बोला जाए।
राजस्थान
Okay, now
तुक्का
आंसर क्या
बोला
लग रहा
जाए
है
बस
आपको?
सिद्धा।
आंसर क्या लग रहा है इसमें? चार में कौन सा होना नहीं चाहिए?
फिर हम उनको बोल देते हैं समाज तो आ जाती हैं 2 बजे के बाद। ठीक,
दुमती.
ओके ठीक है, आई विल कम बाय आंसर आफ्टर दिस क्विज ओवर, बताऊंगा मैं. नंबर 5 का क्या लग रहा है आपको? स्मोकिंग मतलब च्यूइंग च्यूइंग टोबैको है, व्हिच इज नॉट ए च्यूइंग टोबैको,
ब्राउन शुगर.
व्हिच इज नॉट ए
गुड़ा
च्यूइंग टोबैको.
ब्राउन शुगर.
हिंदी में बोलो।
ब्राउन शुगर.
व्हिच इज
हिंदी में
नॉट ए
बोलो।
च्यूइंग टोबैको. ब्राउन शुगर. ब्राउन
हिंदी
शुगर
में
व्हाट इज
बोल लो।
ब्राउन शुगर? What is the brown sugar you thinking about?
सर वो फिल्मों में देखा कुछ पाउडर टाइप का होता है, वो नखों से लिया जाता है।
ड्रग।
What is that actually? उसका composition क्या है? What is the composition of brown sugar? किस ड्रग में माना जाता है?
नार्कोटिक ड्रग सर।
अतुल जी, नार्कोटिक्स बहुत बड़ा, इट्स a very big term. Anything little more specific? Anybody want to give a try? Okay, brown sugar is also known as heroin. You must have heard of heroin, no?
हाँ सर।
Udta Punjab, anybody has seen? You can see heroin is the brown sugar is local name of heroin. Okay,
जी जी सर।
done. Okay. What do you think of ants? Ants का मतलब क्या है? What do you think of ants?
एनर्जी एंड निकोटिन डिलीवरी सिस्टम।
इलेक्ट्रॉनिक निकोटीन डिलीवरी सिस्टम,
इलेक्ट्रॉनिक निकोटिन डिलीवरी सिस्टम.
बेसिकली इलेक्ट्रॉनिक सिगरेट.
All agree?
यस.
सर इसमें एनर्जी एंड निकोटिन डिलीवरी सिस्टम होगा ये।
नहीं, इलेक्ट्रॉनिक निकोटिन डिलीवरी सिस्टम.
इलेक्ट्रॉनिक निकोटीन डिलीवरी सिस्टम जो
इट इज
इलेक्ट्रॉनिक सिगरेट से आती है ना,
इलेक्ट्रॉनिक
वेप,
निकोटिन डिलीवरी
वो
सिस्टम।
आएगा इसमें.
ठीक है. Have you seen e-cigarette?
हाँ जी, एक सिगरेट देखे।
Okay, fantastic. Okay, again I told I'll come to answer one by one once its poll is over, so that everybody give a chance to give it. In the next 5 minutes we'll close the poll and let's see. Okay, number 7 question ये है आपके लिए.
तम्बाकू reduce work performance and cause multiple health problems.
Okay, so 74% लोगों ने second choice को, they've told of second choice, so I'm not going to discuss this one fairly. But what about this first question, first choice? Does tobacco improves concentration? Agree, disagree?
एग्री सर, एग्री।
Agree?
एग्री सर।
Okay. Okay, we'll come back again for discuss. Let's go to the 8th question and with 3 more we'll go discuss. Yeah. What do you think about that? The study, commonest form of chewing tobacco in India is,
गुटखा।
as per the Global Adult Tobacco Survey, which is in 17 and 19, which is the commonest form.
गुटखा सर।
गुटखा तानसेन ही खाते हैं।
गुटखा।
Gutka, anybody disagree with Gutka?
नो
Anybody?
सर, नो, गुटखा इज द राइट आंसर सर।
Okay.
नो सर, इट्स खैनी।
Khaini, okay. Between Gutka and Khaini dilemma is going on. Okay, we have more Gutka, less Khaini people. So how many
Yes.
vote for Khaini? You can raise your hand.
नेवर सर, नेवर।
Never.
ओनली गुटखा।
I see. So people are very convinced. Okay, welcome. As I told, I'll come answer after this. You can all see the answer. Milanji mentioned Khaini there. I'm trying to see the charts also so that I can tell your name. You can see chart and let me know. Vijendra Singh has written Khaini. Okay, that's nice. 9th क्वेश्चन में आ रहे हैं अभी. ये क्या करोगे? इसमें कंपटीशन गोइंग ऑन 50-50.
The majority tobacco. False.
False, sir.
False. False.
See, 50-50 चल रहा है. 20-20 मैच ऐसा 50-50 मैच. 52%, 48%. We have running boats now.
False.
Let's scroll up. It is not scrolling up. Ninth question. Ninth. True or false? Final क्या बना?
False.
False. Okay.
False.
Also, I have to 420 votes, 200 and 219. Okay, as I told, I'll come back to answer after a couple of minutes and tell the answer. You can see the answer and save the answer, but I'll just leaving it now here. What about number 10?
Sir, 9th question answer, sir. What
False.
correct answer?
All answers will come, sir. All answers will come after finishing this one. All the answers will come in your screen only. I'll again repeat. People are already voting now. I don't tell answer now. Let people vote. Once I finish, some answer will come to your screen.
हाँ? वो
Document
पूरे हो गए ना,
past
1000 लोग पूरे हो गए ना, इसलिए नहीं हो रही.
Yes, sir.
मैक्सिमम 1000 लोगों की थी ना.
Okay, what do you think answer for this one?
1000 लोग पूरे हो गए इसलिए नहीं हो रहा.
documenting past quiet attempts.
Okay.
क्यों जुड़ रहे हो?
What do you think all?
Assessing readiness to quit.
Okay, assessing readiness. Thank you very much, sir. Anybody has any other thoughts?
Documenting past quiet attempts.
Okay.
DCPA, sir.
Okay.
Sir, what question, sir? Repeat please once again, sir.
How often do you use in a day? This is a question asking how many years you've been using. So this you are asking question to your patient or person, and which this assess what? So many
No, number
answers.
9.
Frequency and duration, sir.
Supportive advice.
assessing readiness to quit ही पूछेंगे सर उससे छोड़ने के लिए रेडी है.
Ready है नहीं है
For
ना?
understanding the duration and duration of engagement.
Understanding frequency and duration is what Pratik has mentioned. Anybody else is mentioned? You can just let me know so that I can tell, or you can tell. Yeah. Okay. Now, let's come last but one question. Then we'll close it. 11th question यहाँ पर है. You can scroll and show the 11th question.
Understanding.
What do you think about 11th question?
Where the question, sir?
Writing.
Brief and personalized.
Brief and personalized.
Brief and personalized.
Sir, B.
Brief.
Personal approach, sir.
Brief and personalized.
General and non-specific.
Anybody else?
Brief and personalized.
General and non-specific.
Okay. Let's go to next question because we have one directly 12th question में क्या होगा लग रहा है आपको? I will tell all answer मैं बताऊंगा आपको एक एक करके. Then let's finish up this.
Quitting smoking now is the most important.
मैं नहीं join.
Smoking now is the most important thing you can do for your health. Correct? This is answer you're telling.
Yes.
Yes.
Okay.
Quitting smoking now is the most important thing you can do for your health, and I can
Okay.
help you.
Yeah, that is a question people are, thinking about that. Look, come to 13th question. Come to scroll from there.
Provide counseling
Provide
plus
counseling
provide
and provide
nicotine
nicotine
gums.
gum to MGs
This is the
extensively.
Promotion to health.
Counseling.
Provide
13
counseling plus provide nicotine gum to
Okay.
mg 6 times a day.
Okay. Okay.
Nicotine chewing-gums will be given.
Okay.
ये भी देख लो,
Actually
ये अगर आपको
निकोटीन
दोस्तों का
डोजेस
हाँ,
का
ये तो
थोड़ा सा
दर्द और
इशू है, डोज इसमें करेक्ट नहीं दिया हुआ है.
Okay. Okay. So I think, but all you think that 46% think that only counseling, 34% सोच रहे हैं कि काउंसलिंग के साथ गम भी दिया जाए तो अच्छा रहेगा, है ना?
जी.
Okay.
Counseling in HWC.
तो बेसिकली ओनली काउंसलिंग बेटर रहेगा, क्योंकि जो इसमें डोज दिया है वो सही नहीं दिया है निकोटीन का.
ठीक ठीक. Okay.
वो डिपेंड करता है,
Only counseling.
हम जो टेस्ट करेंगे फैगोस्टॉम टेस्ट उसके ऊपर डिपेंड करेगा.
Only counseling.
Okay. Okay. 14th answer. Come to 14th.
HWC level.
Give brief advice about harm and offer help when ready.
बाद में वीडियो चालू है देख.
Give brief advice about harms and offer help when ready.
All agree?
Yes.
Yes.
Yes, yes.
Last question, then close the quiz and see the answers. What do you think about last one? Last question here.
1800112356.
वो दिन में एक बार, वो दिन में एक बार.
356.
1800112356.
Okay.
356. Last number 356.
बताओ.
रात तड़के 4 बजे जाकर के जा.
All agree? Okay.
Yes.
So, right. Already I closed the poll and now you can see the answers. I will be ending the poll and I will share you the results. You can see the results in the screen. Can you see the results screen? Results दिख रहे हैं आपको screen में?
Yes.
Okay. So,
नहीं दिख रहा सर.
दिख रहे सर.
एक गलत है.
तो पहला सवाल का रिजल्ट था 2, 94% आपने सही बोला है. कंग्रेचुलेशन. सेकंड क्वेश्चन द आंसर इज फॉल्स, 76% ने फॉल्स बोला है. इट्स गुड. थर्ड क्वेश्चन का इज जहां पर आई थिंक पीपल वेंट रॉन्ग लिटिल बिट. इट इज 28.6%. बी प्रिसाइजली in India across country if you take the prevalence data 28.6%. okay, then it can varies from different part of the country. Some part of the country has more tobacco than other lesser part of the country. Some part of the country has more smoking than smokeless, so those variation is there. Okay, you can ask question anytime. I'm just for time sake I'm going ahead because you have small talk, then we'll close the program. Okay, bong is what? Finally, bong क्या है? Bong is cannabis, है ना? गांजा जिसको बोलते हैं. Cannabis, ganja or marijuana, different names. So bong is actually form of marijuana. It's not tobacco. All others are tobacco.
ये तो सुनिए.
Fifth number का I think I have discussed this one. Brown sugar is heroin. Others are gudakhu in eastern part of India, snuff western part of India, khaini, as you know, it's very common and we all know it. So correct answer brown sugar. Ants, very interesting. I think everybody knows it. Electronic nicotine delivery system, है ना? E-cigarette, commonly known as. Again, majority correct here. I don't want to discuss this. This is okay. Okay, now this is interesting. Commonest form of chewing tobacco across India is what now? Khaini. Okay. As per the household survey of Global Adult Tobacco Survey 1617, the commonest form of chewing tobacco across country is khaini. Okay. Again, I told you it may vary from place to place, but I'm taking the whole country and talking there. Ninth one, interesting. It's false. 10th. Again, the question actually relevant about ask component, which my colleague Akita will speak after some time. It about asking the frequency and duration, not the readiness. Readiness is, we'll talk about readiness in next presentation. 11th question, answer is, all of you have given fairly correct answer. I can scroll as parallel so I can see the answer. 11th I'm talking now. 11th is the first one. 12th, I think again 60% is given fairly correct and response. So I think quitting is the most important advice that you can give. 13th, okay. Now, counseling plus gum improves the quit rate by 1.5 times versus simple counseling. Now, the gums are available over the counter. You don't need a prescription to get a gum for 2 milligram. So, if you have opportunity, give both. Anybody can give gum. It's not. 14th, I think already mentioned about what to do. And 15th, again, interesting. My request to all of you, if you have no time, at least refer the patient to this number. Across country, free tobacco council available. We'll talk in detail about after some time. Okay, I'll stop here now. Any question to ask? Stop sharing. Yeah. You can stop. Yeah. Any questions or any doubt you have before you go to next session for 15 minutes and close it? Okay. Not there, then I'll request Akita to take over and start the didactic presentation.
Thank you so much, sir. So it was really nice to see such an active participation for the poll. So now we will go ahead with the didactic for today. I'll just share my screen. Just give me a second. I hope my screen is visible to all. Okay. Okay. So today we'll be talking about the brief advice for the tobacco cessation. So this session, this didactic is especially designed for all the CHOs who are working in such a close proximity with the community, just like you all. So we'll be just talking about that. Okay, in a very short span of time, in a busy OPD, in busy screening camps, how we can give small little advices which can really help the tobacco users be on the journey of quitting the tobacco. So we'll go ahead. So by the end of today's didactic हम ये चीज़ें समझ पाएंगे कि फर्स्ट ऑफ ऑल इम्पॉर्टेंट क्यों है एक ब्रीफ एडवाइस देना, छोटी एडवाइसेस देना टोबैको छोड़ने के लिए, टोबैको क्विट करने के लिए. हम कुछ ऐसे की स्टेप्स हम समझेंगे जैसे कि 5A और 5R, जिनकी मदद से हम जो भी पेशेंट्स हमारे पास आ रहे हैं या जिनको भी हम स्क्रीन कर रहे हैं, जिनसे भी हम डेली बेसिस पे हम मिल रहे हैं, और अगर वो टोबैको यूजर्स हैं तो हम उन्हें क्या ऐसा बता सकते हैं जो उनकी हेल्प कर सके ताकि वो टोबैको को क्विट कर सके. इसके अलावा कौन सी कम्युनिकेशन टेक्निक्स हो सकती हैं, ऐसे हमें कैसे डायलॉग्स यूज करने हैं, कैसे शब्द यूज करने हैं जिससे वो मोटिवेटेड फील करे, ना कि जस्ट फील करे. एंड देन अगेन लास्ट में जो कि बहुत इंपॉर्टेंट एस्पेक्ट आता है, विच इज टू वेयर टू रेफर द पेशेंट, हाउ टू रेफर द पेशेंट. सो गोइंग अहेड, सो हम इस पूरे सेशन में विल बी गोइंग थ्रू अ केस जिसके थ्रू हम पूरा ये ब्रीफ एडवाइस का हम पार्ट समझेंगे. So the case for today is Mr. R, who is a 45 years old married male, visits your health wellness center for a blood pressure checkup. You notice tobacco smell and stains on his teeth. When you ask casually, he says, I've been chewing honey for 15 years. It helps me stay alert. तो अब आपके डेली ओपीडी में एक पेशेंट आते हैं जो कि मिस्टर आर हैं. वो 45 इयर्स ओल्ड हैं, वो मैरिड हैं, और वो अपना ब्लड प्रेशर चेक कराने के लिए आए हैं. जब वो आपके पास आए, आपने नोटिस किया कि उनके मुंह से टोबैको की स्मेल आ रही थी और उनके दांतों पे भी स्टेन थे. आपने उनसे आपने उनसे पूछा कि क्या आप यूज करते हैं, तो उन्होंने आपको बताया कि वो पिछले 15 सालों से खैनी खा रहे हैं.
Just a minute. Sorry to interrupt. Can you please explain in English as
Speak in English only.
Okay, sure, sir. Okay, so in this case, what we can do is our next hurdle is that we only have 3 minutes before our next patient, like because it's a busy OPD, we only have 3 minutes. So what can we do in that next 3 minutes so that we are able to provide a brief advice to the patient? So first of all, just like Mr. R, so many patients come up with many health issues. They may be coming up for the hypertension, maybe they have some gastritis issue, but in these cases, the tobacco actually makes all these conditions worse very silently. This is why it is important for us to understand that why quitting the tobacco or tobacco cessation is very important. So if we even see the statistics, so as per WHO, tobacco claims over 8 million people annually worldwide. And in India, if we see as per the Gates 2 survey, 28.6% of adults use tobacco and over 1.35 million deaths annually happen due to tobacco use. But as a CHO, you are at a very important position and a very key position where you are able to identify and also have the opportunity to counsel the tobacco users at a community level, because you're the first, most often you are the first person who is in contact with the community. So एक बहुत ही अच्छी आपकी वहाँ पे you have a very good position from where you can counsel and educate the patient as well as their family. Then talking about that, why what is brief advice basically? So brief advice is nothing but it's a very short and structured conversation which can typically last from 1 to 3 minutes. It basically we do it to motivate the person to quit the tobacco. So it can be delivered anytime. It can be during any routine consultation or during any community visit or during health checkups also. And it is also proven that even this small advice of 1 minute of 30 seconds can really make a difference. It of course it will not completely stop the tobacco use, but it starts a conversation. It brings in the initial step where the person actually starts thinking that yes, this tobacco use is harmful for me and I should do something about it. So that the initiation of conversation happens with this. So even if we see here, like as we initially talked about Mr. R case, so the CHO says that Mr. R, I know quitting is not easy, but even small steps towards stopping Khenny can improve your blood pressure and oral health. Then again, when we talked about that, it can be used in the routine practice. We don't need a specific designated room or designated space or designated time to go ahead with the brief advice. It can be done during screenings, during OPD consultations, and even as per the researchers and WHO estimates also, we see that even when we give this brief advices, the 1 minute of advice also can lead to 1 in 40 users of quitting the tobacco. So for this, we have the 5A model, basically how we can structure this very short conversation, very brief advice is that we have first is ask, then advise, assess, assist, and arrange. So the first step is to ask the patient, like how we are going to ask the patient. So first of all, of course, we will be identifying, we'll be looking for the signs, that if there are any signs, as in the case of Mr. R also, we observe the smell and the stain on his teeth. And then we asked him. So a first step is to identify if there is any person who is a tobacco user. Then when we are asking them about the tobacco use, we have to ask what kind of tobacco are they using, because tobacco comes in two forms. One is smoke and then other is smokeless. In smoke there is bidi, cigarette. In smokeless there is gutka, khaini, pan masala, and other forms as well. Then, of course, we always have to maintain a very non-judgmental and routine manner, so that the patient that we are assessing, they do not feel that we are blaming them or we are they feel singled out. So we have to be very non-judgmental in the manner that we are asking them. So then when we see again, coming back to the case of Mr. R, so the CHO asked, many people in our village use tobacco in different forms. Do you use any products like khani or gutka? Mr. R says, yes, khani, just a little bit after meals. So as we can see over here for the CHO statement, that she did not put any blame, or it was not in a threatening or a blaming tone. She first of all created that yes, many people in our village are using. So are you also using the khani? Then the patient felt comfortable and answered her that yes, I do use khani after eating my meals. Then after first step, we go to the second step, which is to advise the patient. So we always, whenever we are advising any of the tobacco user, we always have to make our advice very, we have to make it very clear. It should be very supportive and it should be personalized. With personalized, what we mean is that it should be short, positive, and specific to the person's health or family. The same advice will not apply to all the patients. The same reason will not apply to all the patients. So we have to make it very personalized specialized for all the patients that we see. Like in Mr. R case, it is that he is currently having his problems with the blood pressure. So we have to tell him that if you stop using the tobacco, your health will improve, your blood pressure will also not have so much of problem. Again, when we go back to Mr. R's example, we can see the CHO says quitting Khani will help control your blood pressure and save money too. It's the best thing you can do for your health. Mr. R says, but I cannot work properly without it. The CHO says, I understand, but with practice, the cravings do reduce. Let's plan one step at a time. So after advising, the third step comes to the assess. Assess basically what we are doing here. Once we give the advice, we see that, okay, what is the person's reason for using and why is he using. Then the next step comes to that, okay, we have to assess the readiness to quit. Readiness to quit basically means that we have to assess how much motivated the patient is to quit their tobacco use. So we ask them the question that are you willing to make a quit attempt in next 30 days? क्या आप एक महीने में अपना तंबाकू सेवन छोड़ना चाहते हैं? So based on their answer, if they say yes, that yes, I want to quit, I don't want to use tobacco anymore, then we move ahead with the fourth step, which is the assist. But if they say that they are not ready, we use another model, which is basically 5R. So again, when we see our Mr. R case, so the CHO says that would you like try quitting in the next month? Mr. R says that maybe, but I'm not sure. CHO says that that's okay. Let's talk about what makes it hard. We'll figure it together. So then, as we already saw that Mr. R is currently not ready to quit the can do over here is 5R is basically relevance, risk, rewards, roadblocks, and repetition. So relevance means again, as we mentioned earlier also, that making quitting personally meaningful, that it should align with what is their priority currently. Like Mr. R is having BP problems, and finances can also be very constrained, so that we have to make it very personalized. So example can be, how would quitting help you your health or your family? Then comes the risk part. So in risk, we highlight the harms of continued use. So the example over here can be tobacco can worsen breathlessness or blood pressure. Then comes the third part, which is the rewards. So basically over here, we emphasize on the benefits of the quitting, that if you quit the tobacco, what and all benefits you can get. So as we can see the example, that you will save money, feel more energetic, and overall your health will develop. Then comes the fourth R, which is roadblocks. So basically here we are exploring the barriers that, okay, when Mr. R is on his journey of recovery and when he's trying to quit tobacco, what and all barriers or what and all problems can occur in on that path of quitting. So basically we ask him that, okay, what do you think would make it difficult for you to quit? As we saw earlier that Mr. R mentioned that the tobacco use helps him stay alert. So that is why we have this is one of the difficulties that he faces, that if he doesn't use tobacco, he will feel more drowsy, or maybe he will not be able to do his work. Then comes the last R, which is basically reinforce at each visit. So the example can be, even if you're not ready now, we'll talk again next time. So repetition is basically, it can be there that, even after you have explored so many reasons with your patient, the patient may still be on the same path that, I'm not ready to quit right now. So in that instance also, we have to again maintain our non-judgmental approach, and we always have to give the space to patient that it is okay if you're not ready right now. We can talk about it in the next visit, or we can talk about it when you are ready also. So basically we are reinforcing that 5A again on every visit. So this is the 5R. So basically, after let's assume that after putting the 5R, after talking about so many things, Mr. Ram is able to, he kind of convinced that, yes, I do want to now make a change. So then we go to the step 4. Basically, now the patient is ready to make the quit attempt. So then now, because they are ready to make a quit attempt, so now we will help the patient make a quit plan. So in quit plan, what we basically start with is, first of all, we set a quit date, that okay, on this date you have to, like, this is your quit date, and after this you will not be using any tobacco product. So in that during that phase, what we ask them to do is that, first of all, you have to remove all the tobacco products from your home and the workplace, so that you are not inclined, or that you're not inclined to use the tobacco product again. It is not in your near vicinity. Then ultimately coping with the withdrawals or the cravings. So because the moment they will stop using the tobacco, there will be withdrawals, there will be cravings. So we will have to educate them as well as their family that what are withdrawals, what are cravings, and how can we cope up with those withdrawals and craving symptoms as well. Then again, as referral is one of the very, very important point when it comes to any health problems. So then we have to offer them many referral points so that they can seek help whenever they feel or whenever there is urgency for professional help. So of course, they can be referred to the further specialty centers, further CHCs also. But many a times when people do not want to go to the hospital directly because maybe there is a taboo or maybe they are hesitant. So in those cases, for their comfort, they can also make calls from their home or anywhere. So one of it is a National Tobacco Quitline, which number is 1800112356. They can call and the counselors will be ready to help them. The other is Cessation program, where they can SMS quit to 5616115, and they will further have many messages which will ultimately be helping them in quitting the tobacco. So now here, just quickly we'll see the example for Mr. Ram again, Mr. R again. So CHO says, let's fix your quit date as next Monday. I'll help you prepare. You can also call 1800112356. They'll support you daily. Mr. R says, okay, I'll try. So this is how we have assisted Mr. R. Then comes the last step, which is arrange. So here what we do is basically we schedule a follow-up contact as well, so that we are there to support him during his quit attempt. We check the progress during next visits, during phone calls or community follow-ups as well. And then we reinforce the success or help troubleshoot the relapse. So, there can be chances, where the relapse is happening, where even though maybe he is not using a substance not using the tobacco for a few months or few days, but again he goes back to using the substance. So that is called relapse, that again going back to the same pattern. So in that moment also, we always have to maintain our non-judgmental stance and provide the complete support. So whenever they are in any, they require any help from our end, we will always help them. And whatever progress they are making, we will always affirm those, we will always be celebrating those little progresses as well. So again, when we see that, okay, CHO, I'll call you next week to see how you're doing. If you slip, no problem, we'll try again. Mr. R says, thanks, that helps. So this is the overall how brief advice can be given, even a very short duration in a very busy settings as well. So if we just conclude it, so the role of a community health officer in tobacco cessation can be, even if you see in our case, the CHO supported Mr. R through all the 5 steps. And that's exactly what even our role looks like as a CHO in the daily practice. So as we see that there was a screening, there was brief advice, there was referral, and then there is follow-up. So even if we just kind of highlight the main roles of the CHO, so it can be identify and document the tobacco users, deliver brief advice using 5A, motivate and support behavior change, provide assistance and referral, arrange follow-up, promote tobacco-free environments. So now to end this today's session, today's didactic is the take-home message is that ask, advise, assist, arrange. Every step counts. So any step you can use to further give the advice to the patient. Every visit is an opportunity to talk about the tobacco, and personalized supportive advice increases quit attempts, and CHOs can deliver life-saving interventions in just 3 minutes. So these are the references for today. So thank you so much for listening actively. Over to you, sir.
ओके सो हम लोग करीबन खत्म करने वाले हैं. लास्ट स्लाइड्स आई थिंक विल फिनिश, देन विल क्लोज द प्रोग्राम एंड टेक सम क्वेश्चंस.
So a little bit like we already have heard from Akshita's presentation about the Quitline number. So I just want to tell a little bit brief about it. So you must have seen this 1800112356, this toll-free number in all the tobacco products, like in cigarette packets and everything. So what it happens, it's a tobacco Quitline center. It's a telecounseling intervention that is given. So the counselors are there, like a group of 23 counselors, and we are open from Tuesday to Sunday from 8 a.m. to 8 p.m. So if you refer to anybody to call into this number, there are a group of counselors who will be giving a very given the assessment. They will take the assessment. They will be given with the advices with counseling, pharmacological helps, monitoring, follow-up, and will help with e-resources as well. So this number, which is toll-free, you must have noticed everywhere. So this is the very brief about National Tobacco Quitline Service. Over to you again, Akshita.
Okay, so this is another primer that is for the mental, neurological, and substance use disorder, which are basically MNS disorder. So this is again a e-learning platform, e-learning primer. So its duration is 2 months. It's priced at 472 rupees. Basically, it has with this primer, you'll be able to understand the common MNS disorders which are present. You'll be able to identify that, okay, what kind of MNS disorders are there and how to deal with it, how to identify all the symptoms, and ultimately any of the events. So it was it will be really helpful for all the CHOs, and it provides a very basic and elaborate knowledge on all the basic conditions. There are overall seven lessons in that, and all of them contains quiz also, which really helps in active learning. Basically, you get certification also for it. The certification is available for all the lessons that you complete, and then an overall certification also, which is when you end the course. So this is just for the primer on the MNS disorders. Over to you, Mahashweta.
So let's close the thing. Any quick questions? I can stop screen sharing. Any quick questions for anyone before you go for the group photo? कुछ सवाल है तो आप पूछ सकते हो before you go to group photo. Then we'll close it up. Manju, are you ready for the group photo? I think so that we can.
So quick instruction for the group photo. Kindly turn on your videos.
Feedback first, no?
Yes, we have already shared in your Zoom chat. You can see one link, that is the feedback link. So it will be
Share again so that people.
We'll be sharing the feedback link again. So we'll request you to kindly click open to that link and give your valuable feedback.
So we'll wait for 10 seconds. Is Manju is ready for photo or where is he? Ready? Okay, Manju will wait for a couple of minutes, maybe 5 seconds before we get them to give the feedback. So please go ahead with the feedback link. What I'll do, I'll probably like to share the feedback with all of you. You can see the screen also. Yeah. So feedback is live now going on, and I think just give your feedback so that we will. So, yeah. So we have how many votes? 18 votes. Please, can you share the link again so that people can struggle? But click the link. It's anonymous with feedback. You don't have to. You don't have to. You know. कोई सवाल है तो 2 मिनट हम ले सकते हैं. Any question, please ask. Meantime, we give the feedback. Just click the link and any feedback you can pass it.
May I, sir?
Please, definitely. Yeah. Go ahead.
Yeah.
We have a couple of minutes. Yeah.
Yeah. This is Ritik Khoma. A very good afternoon to each and every one of you. Yeah. Thank you for the session. First of all, sir, I would like to have some testimonial videos. Do you guys have any testimonial videos that we can share in the community for showing up the real coverage of a patient who has been suffering from the tobacco or oral cancer, so we can get the real data and we are able to convince them in the then and there.
I think definitely. So we had did 2 years back a campaign for the people who has quit tobacco for substantial time. They given a testimonial in a small video format. What we will do if you will send a mail to us? Can you give a TQL mail ID?
I can definitely mail you. Could you please share with me?
And we taken the consent from the people who has given the video to be shared. You just drop a mail so that you can share the folder with you and definitely
kindly share the mail. Kindly share the mail. I'm noting now.
Just one email I will send just so that you can send the email.
Definitely.
Fantastic. Anything else? Anybody has any thoughts or point? Any suggestion? Welcome, please. Yeah. Yeah, group photo. Please don't leave. Stay for a couple of minutes. But Manju can take group photo. No, you can start a group photo. Lovely to have a photo with all of you.
Please. We'll be taking a group photo.
Sorry to interrupt you right now. tql@gmail.com. Is it the same mail, sir?
Yes. The chart that's gone, same email ID.
Yeah, I've seen, sir. I've seen. Okay, definitely. Thank you so much, sir.
Take the photo. I'll stop here. All right, we'll have last probably 3 seconds to take group photo and close it. We'll share the group photo with all of you. Just a minute. Let's wait for our IT team to tell us.
We request all of you to keep your videos on. Those who are joined with mobile phone, keep your mobile in horizontal zone. We will count the number 1, 2, 3. When I finish the number 3, you have to smile so that I can take a snap. Ready? Okay. 1, 2, 3. Thank you. We'll take one more. We'll give a count again because we have a lot of participants. Okay, ready? 1, 2, 3.
Done?
Yes.
Okay, I think from all of us from Nimans, thank you everyone for all your time. We are grateful to your time. Thanks the team that behind working 24/7, handling the whole thing. We have a couple of colleagues from YouTube. And I think you got the email ID of the thing. Can you send your email ID to the website?
Yes.
So if any questions, please drop a thing. Any material you want to in your AM or hospital to be displayed, let us know. I will send in chat with our phone email IDs that have been shared. Drop a mail. In a week time, we'll try to provide things. Any reading content, anything that you want to start your services, feel free to drop us. Definitely, we'll try to help you out in our capacity. Thanks a lot and have a pleasant evening. Bye bye from all of us.
Thank you, sir.
Thank you.
sir.
Thank you, sir.
Thank you, sir.
Thank
Thank you, sir.
Thank you very much.
Thank you so much, sir.
Thank you, sir.
Thank you,
Thank
sir.
you, sir.
Thank you, sir.
Thank you so very much, sir.
Thank you, sir.
Thank you, sir.
Yeah. Don't feel sending the feedback.
Thank you, sir.
Thank you, sir.
Yeah, please do the feedback. Don't forget. The feedback is very
Thank
critical.
you, sir. Thank you.
Send the link.
YouTube live stream
Thank
also
you,
share.
sir.
Yeah. Madhu.
Thank you, sir.
Thank you, sir. Thank you, sir. ठीक है Thank you, sir. Thank you, ma'am.
Thank you very much. I know you have not switched on video, but thanks to all of you. I mean, you must be busy in something or other work, but please give the feedback link I've sent to you. It's very critical for us to, learn about what is happening. Yeah.
Okay, sir.
Yeah. Thank you very much. Thank you. We'll close now.
Yeah.
Yes. Let's close now and have pleasant evening.